Hi, we are team number 1 and we will talk about HIV or AIDS.
Clinical case. Paul, a 25-year-old patient who comes to the ER because he has had some unusual symptoms for 1 or 2 weeks, such as fatigue, sore throat, fever, chills, and rash. About 3 weeks ago, he went to a doctor who prescribed medication thinking it was a simple infection. But the moment Paul realized that the medication had not affected him, it was when he made the decision to go to the ER again. When Paul arrived at the hospital, the doctors asked Paul if he had had any recent sexual activity, or if his blood had been in contact with someone else's blood, or if any objects had touched his blood. When Paul commented that he had had blood tests done weeks before, the doctors immediately carried out blood tests to find out what Paul had. After several tests and blood studies, the doctors denied certain diseases, but for the HIV disease, he was positive.
How this illness diagnosis? HIV can be diagnosed through a rapid diagnostic test that provides same-day results. But after that, we need a confirmatory test by a qualified and validated health worker at a clinic. People develop antibodies to HIV within 28 days of infection. During this time, people experience the called window period. That is when they may transmit HIV to others. On the note, we can see a baby because for babies or children that may have it from genetic, they must have a virology test to confirm it. Treatment. Until now, there is no cure for this illness, but HIV can be suppressed by a therapy consisting of 3 or more antiretroviral drugs. This doesn't cure the HIV, but it ends the window period. This is the HIV drug chart, and there are many examples of pills that you can consume to suppress the HIV.
I'm going to talk about the immune response in the clinical case of Paul. So in this case, we're only going to use the acquired immunity. We are not going to focus on the other immunity. So the acquired immunity is immunity that develops during your lifetime. It can be divided into active immunity and passive immunity, as we can see in the diagram. And it divides also in natural and artificial, each one. So as we can see in the clinical case of Paul, we can conclude that the immune response will be a passive immunity because it develops after Paul received antibodies from someone or somewhere else. And to be more specific, we're talking about a passive artificial immunity because the antibodies that Paul is going to receive will come from a medicine, a gamma globulin injection, or also an infusion.
Pre-exposure prophylaxis, or PrEP, is a way for people who don't have the HIV but who are at very high risk of getting HIV to prevent HIV infection by taking a pill every day. Other ways to reduce the risk of getting HIV are: choose less risky sexual behaviors, use condoms, limit your number of sexual partners, get tests and treat for STD, don't inject drugs.
Critical barriers. When HIV is introduced into a person's body, it inserts genetic material into the nucleus both of certain cells in our defense system and forces them to produce copies of itself. At first, our immune system responds and tries to prevent attack, helping the body recognize and defend against pathogens and infections. It is so difficult for us to see if we are carrying this virus because the symptoms can become quite common, from a sore throat, a headache, to skin rashes or bleeding.
The immune system is a set of tissues which work together to resist infections. The skin is one of the first defense mechanisms in your immune system. Tiny glands in the skin secrete oils that enhance the barrier function of the skin. Immune cells live in the skin and provide the first line of defense against infections and viruses, such as HIV. So if you do get HIV, one of the earliest harbingers of it will be your skin. When certain infections or conditions develop, it can often be a sign that the HIV is progressing. Lymphocytes are white blood cells that help fight infection. CD4 is a blood test that measures the number of lymphocytes in your body. The lower a person's CD4 count is, the more likely it is that they will develop certain skin lesions. The higher the levels of CD4 a person with HIV has, the better they can fight infections, including those that affect the skin.